Hello, and welcome to part 2 of our encounter with meditation. In this video, we shall look into the relationship between meditation and psychology, specifically therapy. Part 1 approached meditation from a spiritual perspective, where we discussed the 4 techniques of meditation. In this video, which is part 2, we shall look into meditation from a scientific perspective. According to the American Psychological Association, meditation can be understood as a training of our attention to achieve a mental state of calm concentration and positive emotions. Meditation has 2 elements or 2 aspects: attention and acceptance. Attention refers to awareness of the breath, emotions, thoughts, physical sensations that we might be feeling while we are meditating. Acceptance refers to being aware of the emotions, sensations, thoughts, breath, but not reacting to it, not judging it, noting it and letting it go or letting it be. For instance, we might feel a surge of anger while we are meditating about something that happened 5 minutes before we started meditating. The acceptance element of meditation states that we do not let the anger take over us, nor do we judge ourselves for being angry, nor do we judge the anger. We don't get angry at ourselves for being angry while meditating. We just let the anger be. We are aware of it, but we don't react to it. Mindfulness puts this attention and acceptance into practice. Mindfulness helps to achieve this state of non-reactive awareness through breathing exercises, yoga, and meditation. Programs that include mindfulness may combine mindfulness or other meditation practices with other techniques. For instance, mindfulness-based stress reduction or MBSR combines the use of mindfulness with other discussion sessions as well as other strategies to help people deal with stress or deal with stressful situations. Lessons that they can actually apply in stressful situations. In mindfulness-based cognitive therapy or MBCT, mindfulness is used alongside cognitive behavioral therapy to treat patients. Researchers have focused on 2 types of mindfulness practices in therapy: mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT. Mindfulness-based stress reduction or MBSR. It is a therapeutic intervention which involves weekly group classes combined with daily meditation practice sessions to practice at home. This is stretched or spread over an 8-week period, and it involves both yoga as well as meditation. Mindfulness-based cognitive therapy or MBCT. Cognitive refers to conscious mental processes. It refers to processes of thinking or reasoning, such as when we plan, when we strategize, when we prepare an argument, when we prepare a to-do list for the day, for the week, for the month. These are all mental processes that are consciously undertaken. Therefore, conscious mental processes. It involves thinking, it involves reasoning, and that is what cognitive is. Mindfulness-based cognitive therapy is also a therapeutic intervention. It involves the elements of mindfulness-based stress reduction, MBSR, with cognitive behavioral therapy, and it is used to treat depression. What is cognitive behavioral therapy? Cognitive behavioral therapy involves changing thinking, or behavior patterns. Three of its core principles are: firstly, psychological problems are based in part on faulty or unhelpful ways of thinking. Second, they are based in part on learned patterns of unhelpful behavior, which means these are patterns that we have that are unhelpful, and we have learned them, we have acquired them and cultivated them over a period of time. And because it has been learned over a period of time, we can learn better ways of coping with them, which is the third principle. People suffering from psychological problems can learn better ways of coping with them, thereby reducing the symptoms of the problems, and that is how we become more effective in our lives. A research conducted on 200 healthy people showed mindfulness-based therapy to reduce stress, anxiety, and depression. Mindfulness-based cognitive therapy has also shown beneficial changes in people who have had previous episodes of major depression. It has proven to help them avoid a relapse. Psychology research also showed that mindfulness-based cognitive therapy recipients are less likely to give in to negative emotions or react in unhelpful emotional ways in times of stress. On the other hand, in his article in the British Medical Journal, Peter Fenwick raised questions and doubts on meditation in therapy, and he suggests that prolonged meditation only be undertaken in groups where the likely effects of the meditation technique is known and can be dealt with, because prolonged periods of meditation have known to induce psychotic episodes, depression, or in some cases even suicide. Peter Fenwick further stated that while studies suggest that meditation has been beneficial in dealing with stress and stress-related mental health issues, the dropout rate has been high. Dr. Gabor Mate explains that stress in medical terms is a disturbance or perturbation of the body's biological status in response to a threat from the environment. Chronic stress impairs the body's immune system, and he has elaborated on the relationship between the mind and the physical body, specifically focusing on stress and repression of emotions in his book When the Body Says No. Mindfulness dials down the body's response to stress, thereby reducing its consequent damage to the physical body. Peter Fenwick has also stated that studies on meditation suggest that it is beneficial and it causes beneficial changes in one's personality. While prolonged meditation may require guidance, mindfulness is something that we can do. It is not extensive and it is not demanding. And if it reduces stress, which will result in beneficial changes in our physical body or protecting our physical body, then why not? The mind is complex and mysterious, and that is perhaps why meditation seems intimidating. The brain is studied through biology or medicine. The mind is studied through psychology. And the impact of meditation on both the structure of the brain as well as its influence on the mind has been measured, and we know now that it can be studied. But the influence of meditation or the impact of meditation on one's personality or on one's perception of life cannot be measured. An interest in meditation, however academic, requires experiencing it to however minute a degree as is possible for us. And mindfulness is something that we can do. It is not extensive, it is not demanding, it does not require us to move into a cave or a retreat center. But if we are still skeptical, then there are alternatives that we can turn to enrich our understanding of meditation even more before we dive into it completely, such as American psychologist Daniel Goleman's book, The Science of Meditation. If you would like to know which meditation technique would be appropriate for you or would be more suitable for you, please check out part 1. And with that, we conclude this brief encounter with meditation. I hope it was helpful. Thank you for watching. Do subscribe.